Hello. There's been widespread condemnation today of the out-of-hours health service in this country. It follows the death of a patient in Cambridgeshire. The government has now ordered a thorough review after a coroner in Wisbech recorded a verdict of unlawful killing.
It was just under 2 years ago, on a Saturday afternoon in February, when this man, who was 70, called for help from an out-of-hours GP. The locum doctor who turned up on his doorstep in Cambridgeshire was exhausted. He'd arrived in East Anglia the day before after a tiring journey from his native Germany. He spoke poor English. The patient he treated, David Gray, shook his hand and said thank you when he left. But 4 hours later, Mr. Gray was dead. He had mistakenly been given a fatal overdose of painkiller. Over the next 30 minutes, we will tell the full story and bring you reaction and comment from those involved. Let's start with the coroner's inquest in Wisbech and our chief reporter, Kim Riley.
For Mr. Gray's sons, Stuart and Rory, this the verdict they wanted. Coroner William Morris said Dr. Daniel Ubani didn't mean to kill their father, but he should have sought advice before injecting the retired electronics engineer with 100 milligrams of diamorphine. The coroner said this was gross negligence manslaughter. David Gray was unlawfully killed. Mr. Morris then asked the vital question. How was it a doctor who didn't obtain his qualifications in this country, whose first language was not English, who was probably fatigued, who had an inadequate induction, who didn't know the local area or the NHS system, how come he came to be treating patients in Cambridgeshire and treating at least some of them incompetently? The coroner asked, how was this lamentable situation reached? He cited an EU directive of 1993, which aims to facilitate the free movement of doctors and the mutual recognition of their diplomas, certificates and other evidence of formal qualifications. He's asking the Health Secretary for a review of the directive as it affects the UK and has made 10 other recommendations in a bid to prevent a similar tragedy happening again.
We welcome all of the coroner's suggestions and recommendations, and we hope that they will reduce significantly the chances of such a tragedy reoccurring anywhere in England.
Do you accept that Dr. Ubani shouldn't have been allowed to go out and practice?
Yes, Dr. Ubani was clearly incompetent, shouldn't have been on the soil in this country practising medicine. He's a disgrace to medicine.
Sandra Banks was given an injection by Dr. Ubani on his fateful first shift for Take Care Now.
It eased my pain for about an hour, and then I started going downhill quite rapidly. He didn't come over as being confident, he didn't speak good English, he certainly didn't read English. So Steve called an ambulance instead, and that was me taken off to hospital for the next 2 days.
David Gray is buried in the family grave at Upwell, his family now pursuing civil actions against Take Care Now, NHS Cambridgeshire and the doctor whose actions took his life away. Kim Riley, BBC Look East.
So let's have a look at the time frame for Dr. Ubani's one and only shift. He flew into Stansted on the morning of February the 15th. He took a hire car from the airport to Colchester, the offices of Cimarron, the locum agency which employed him for an induction. Later that day, he drove to the Ipswich offices of Take Care Now for computer training and the handover of his drug kit. He left around 10 p.m, but confusion with the roads meant it wasn't until 4 o'clock the following morning that he arrived in Newmarket at his B&B. At 8 o'clock, after 3 hours' sleep, he started his shift. He arrived at David Gray's home at Manea at 4:45 in the afternoon, after a response to a call from the family. Well, we can cross live to Mr. Gray's house in Manea now and talk to his son Stuart. This must have been a gruelling ordeal for you. How are you feeling now the inquest is over?
Well, we're very happy, obviously, with the verdict and the recommendations that the coroner's made under Rule 43. It has been a long, tiring day, but at the end of it is all worth it now that we've got the major issues out and the coroner's made these recommendations. The next step, of course, is to make sure they're acted upon by the Health Minister.
That's what I was going to ask you, because there were strong words from the coroner. You say you want lessons to be learned. How confident are you that they will be?
Well, we've seen this before where coroners make recommendations and they aren't acted upon. So, I mean, I'm hopeful that obviously they will be acted upon, and my brother and I are going to put a lot of pressure on. We're not going to take our foot off the pedal. We're going to keep putting the pressure on the government, and in the hope that actions will be taken, and it can only help to have media and public attention on this tragedy.
You are a GP yourself. How worried are you about the way out-of-hours services work?
Well, we're 2 years down the line now following the death of my father, and although these recommendations have been made to date, no major changes have been made in the system, so there's nothing at present to stop such a tragedy occurring again.
As a doctor, what is your opinion of Dr. Ubani, given that he didn't attend the inquest and hasn't been held accountable in this country for what he did to your father?
Well, I'm incredulous. We have no evidence he actually had any specific GP training in his own country or even worked as a GP. So what he's doing over here, being on a UK general practice register, I don't know. He must have been very well aware he was well out of his depth treating these patients, and the disastrous consequences he left behind in just a weekend.
Dr. Gray, thank you very much for talking to us.
3 months after Dr. Ubani gave that fatal overdose, he wrote an email to the Gray family. I have a copy of it here. In it, he asked for forgiveness and admits his mistake. This is what he said: "The circumstances arose from the confusion between the drugs pethidine and diamorphine, a drug which I have not been conversant with, based on stress and my overstretched nerves on the day of my shift." That email was sent to Take Care Now, but it did not reach the family. So he wrote again, this time direct to their home. In this letter he says it was his only fatal mistake in 22 years as a surgeon. He says there's no amount of remorse, grief or explanation on my part that can satisfy or replace the life of your father and head of your family. I was too tired and lacked concentration. He ends with these words: "Please forgive me." Now, we wanted to put our own questions to Dr. Ubani. Tracking him down proved to be very difficult. As we've heard, he has continued to work in Germany despite receiving a penalty there for his offences in the UK. Our Home Affairs correspondent Sally Chidzoy has been to northern Germany, to his hometown of Witten, searching for answers.
Outside Dr. Ubani's clinic in Germany, his family show their contempt for the media. Daniel Ubani is hiding away. Ubani's relatives log our car. They watch. They intimidate. They are not the best advertisement for Dr. Ubani.
Clearly, as you can see, quite an icy reception. I think those were Dr. Daniel Ubani's sons. One of them has just threatened me with the police, telling me to leave. Others, too, not too happy that we are here.
So the doctor, who quickly returned to Germany after killing and harming patients, gains protection from the German police. Officers want our passports. They demand €900 because we walked onto Dr. Ubani's driveway to ask for an interview. Lawyers advise us to refuse to pay up. The police back off. This is the German prosecutor who investigated Ubani for the killing of David Gray. Ubani was given a 9-month suspended prison sentence, and he was ordered to pay a fine of €5,000.
Es handelt sich bei der Tat eine Fahrlässigkeitstat.
This is a case of negligence. The doctor was clearly completely overwhelmed by the demands of a house doctor at the weekend, totally out of his depth. He made a mistake. He was also probably the victim of the fact that a fatal dose, ready to inject in one go, was to be found in the medical case. He has shown himself to be very remorseful.
Cambridgeshire detectives met police in Witten hoping to bring Ubani back. He failed to show. So how did Ubani, an anti-aging expert, end up killing a patient in Cambridgeshire? Local doctor Johann Kroll provided Ubani with a false reference. Dr. Kroll claimed to have worked with him for 20 years, but when questioned by police, he admitted he only knew him through seminars. Dr. Ubani's records reveal he became a doctor in Germany in 1982. It appears he never received training in general practice, but a primary care trust accepted his application. He was free to work in England and Wales.
If I were the NHS, I'd definitely refrain from bringing in foreign doctors.
This GP and surgeon from Witten says he wouldn't work in the UK because he'd worry about language problems and the different names here for pills and medications.
There should be some sort of testing from the British side to ensure that the doctors who are actually working in Great Britain are fit for treating patients there.
In Witten, Dr. Ubani continues to treat patients, and yet most people don't know about his past.
Well, it's a scandal, of course. I'm a doctor, and I think he should be punished in England as well.
This is unbelievable. The authorities should take away his work permission.